Hi everyone, I'm Jed Schlackman, a holistic counselor and spiritual energy healer. For this video I'll be speaking about the topic of bipolar disorder, which is a diagnosis used in the mental health field. Whether or not you view diagnoses as something that's helpful or not in helping people with psychological challenges, we can start out just considering what that particular diagnosis means or represents, what symptoms or patterns it's trying to describe. So bipolar is a reference to mood. So our mood can be elevated or depressed. So in a bipolar diagnosis, the person being given that diagnosis is perceived to be swinging from one of those poles or extremes to the other. So they have episodes, times where they're displaying some depression, and other times where they're appearing to be what's called manic or having mania, where there's a ton of energy. It's actually sometimes hard for them to rest and relax, hard to slow down. They're just full of passion, full of excitement, full of energy to be doing things. So that's the manic side. And the underlying idea here is that the person has a hard time being stable or balanced within the middle zone, we could say, where they're always at one extreme or the other. They're not really often on a more even keel. So they're either seeing things in a super positive way or a super negative way. Either their energy is overly revved up or overly withdrawn. So that's kind of just a basic idea or understanding of what bipolar is referring to. In the mental health field and in psychiatry, it's often viewed as a major mental illness and often treated with some type of medication that's designed to in some way stabilize or suppress those mood swings. But those medications often have significant side effects or adverse effects that may go along with it, and potential long-term harm or impairment to the brain and nervous system, as well as to the body's metabolism in general. So we're here in this video exploring some other approaches, some more natural and holistic ideas and interventions to help people that have that bipolar label function better and really come into more balance in their life. So to support this discussion, I'm referencing and reading from a book which is about 20 years old now, and this is The Natural Medicine Guide to Bipolar Disorder. And this is by Stephanie Marone, who's actually, you could say, a medical and mental health journalist. She's not a physician, but she gathered information from many different physicians, multidisciplinary information, exploring different approaches to bipolar. And she has a whole series of books on mental health with a natural medicine approach to all the common major mental health conditions. So in this book, we can start out at the table of contents just for an outline of some of the approaches that she's covering. So the first part is the basics. What is bipolar disorder? Who suffers from it? And then what are some recognized causes, triggers, and contributors? So what potentially might be triggering or causing that pattern, those symptoms. And then the next part is the actual natural medicine approaches. So what are the natural medicine treatments for bipolar disorder? And she has different chapters for different treatment interventions. There's a model for healing, and then healing from a cellular to a spiritual level, biological medicine, biochemical treatment of bipolar disorder, amino acids, giving the brain what it needs, restoring the tempo of health, cranial osteopathy, bipolar disorder and allergies, and AET, the allergy elimination technique, rebalancing the vital force, homeopathy, and the shamanic view of mental illness. So those are all the different approaches she's looking at. And we'll turn first to a model for healing and looking at what is this philosophical model or understanding that kind of outlines how you would approach healing. So here we are at that. And she refers to Dr. Dietrich Klinkhart's approach, which is a model that has 5 levels of healing. While many people speak generally of the body-mind-spirit connection, Dietrich Klinkhart, MD, PhD, based in Bellevue, Washington, has developed a detailed paradigm that explains that connection in terms of 5 levels of healing: the physical level, the electromagnetic level, the mental level, the intuitive level, and the spiritual level. Dr. Klinkhart is internationally acclaimed for this brilliant and comprehensive model of healing, for his expertise in neural therapy, and for several effective therapeutic techniques he has developed. He trains doctors around the world in his model and techniques, and is perhaps the person most responsible for bringing neural therapy to the attention of the medical and lay communities. Bipolar disorder, like any health problem, can originate on any of the 5 levels. A basic principle of Dr. Klinkhart's paradigm is that an interference or imbalance on one level, if untreated, spreads upwards or downwards to the other levels. Thus, bipolar disorder can involve multiple levels, sometimes even all 5, if the originating imbalance was not correctly addressed. Another basic principle is that healing interventions can be implemented at any of the levels. Unless upper level imbalances are addressed, restoring balance at the lower levels will not produce long-lasting effects. This provides an answer to why rebalancing the biochemistry of the brain does not resolve some cases of bipolar disorder. Treating the chemistry only addresses the physical level of illness and healing and leaves the causes at the intuitive level, for example, intact. The brain chemistry will soon be thrown off again by the downward cascade of this imbalance. The 5 levels of healing model also provides a useful framework for the natural medicine therapies covered in the rest of this book. You'll see that they approach bipolar disorder by identifying and treating disturbances at the different levels. In keeping with the holism of natural medicine, a number of the therapeutic modalities function on several levels. For example, biological medicine works on both the physical and electromagnetic levels, while homeopathy works on the mental level and family systems therapy works on the intuitive level. So that gives you some basic understanding of that paradigm or philosophy of providing healing on these multiple levels. So you can work with the biological, biochemical level, which could involve nutrition, using certain types of diets and supplements, You could do some form of detoxification, working with environmental medicine to avoid exposure to different chemicals in the environment. You could be clearing parasites and molds and infections from the body. You could be resolving allergies. So all of those things that are in a sort of more direct physical way affecting the biochemistry might be addressed. You could also work with emotions, with family systems. So seeing how that person's early childhood may have fostered a certain personality pattern or a certain way of reacting to life, certain fears, insecurities, etc. So those are all relevant ways to intervene, and we don't have to choose one level or another. We can work simultaneously on healing with more than one level of that 5-level system. So with that in mind, I'd like to bring us to what I look at as the energetic or spiritual level, which is actually toward the end of the book, The Natural Medicine Guide to Bipolar Disorder. And this starts out with the idea of the shamanic view of mental illness. There's a well-known African shaman who's named Malidoma Patrice Some, and he's an internationally celebrated African shaman and teacher. And there's actually an article or video you can find on the internet that talks about what a shaman sees in a mental hospital, and that shares this particular shaman's perspective, his observations about these issues. With bipolar disorder, Some has found that the main underlying problem is disconnection from one's life purpose. This disconnection leaves room for some alien energies to come in that don't have anything to do with the kind of promise this person made before coming into this world. The promise of what one will fulfill in one's life. Not fulfilling your promise leaves you subject to mental disorders. So it's kind of saying you're out of alignment or out of harmony with your own soul. And as a consequence of that, different energies from your environment can start to attach to you and impact or influence you. So that could be a theme in some types of mental illnesses that people are observing. So with bipolar disorder, depression, anxiety, and addiction, Dr. Some has found that the main underlying problem is this disconnection from one's life purpose. Bipolar disorder in general has a lot to do with the nature of the contradiction that the person is living. One pole is the personal promise, the other is the reality. These two poles may not like each other because they're not complementary. The cultural context of the West is often responsible for the contradiction because it doesn't support people in fulfilling their purpose. They come into a culture that wants them to acquire a certain kind of skill in order to make a living. That messes up a lot of people. The shaman can see what a person's purpose is. The divination doesn't hide these kinds of things, says Dr. Some. The shaman's task in this case is to tell people their purpose, but only after preparing them through rituals so they are in a position to understand what is revealed. The ritual used is called a dupulo and works to correct the changes done to the original promise. It's like a disruption of the current path the person is in. It prepares the space for the promise to come alive in the person. After the ritual, the shaman lets a week or two pass to let it sink in, and then helps the person to become consciously aware of her promise, the specifics of her purpose. At that point, it's up to them to take it or leave it. If they decide not to fulfill that purpose, they will go back into illness. The choice is theirs. They can choose to be ill or choose to be aligned with their path. Another common thread that Dr. Some has noticed in mental disorders is a very ancient ancestral energy that has been placed in stasis, that finally is coming out in the present. His job then is to trace it back, to go back in time, to discover what that spirit is. In most cases, the spirit is connected to nature, especially with mountains or big rivers, he says. In the case of mountains, as an example to explain this phenomenon, it's a spirit of the mountain that is walking side by side with the person, and as a result creating a time-space distortion that is affecting the person caught in it. What's needed is a merger or alignment of the two energies so the person and the mountain spirit can become one. Again, the shaman conducts a special ritual to bring about this alignment. Dr. Sommer believes he encounters this situation so often in the United States because most of the fabric of this country is made up of the energy of the machine, and the result of that is the disconnection and the severing of the past. You can run from the past, but you can't hide from it. The ancestral spirit of the natural world comes visiting. It's not so much what the spirit wants as it is what the person wants, he says. The spirit sees in us a call for something grand, something that will make life meaningful, and so the spirit is responding to that. So we can see that there's these multiple levels, and often the deepest, most profound level is our spiritual purpose. As a spiritual being, what did we choose to come into this life to experience or create or manifest? And how much aligned with that are we in our present point in our life? Have we gotten, in a sense, off track? Have we been diverted? Are we conforming to some societal or cultural norm that's actually conflicting with what our spirit desires to express? And if that happens, how do the symptoms of a, quote, mental illness reflect that disturbance? So looking at bipolar disorder, a person can be very elevated in their mood, but it doesn't last, and then they go to the opposite extreme where they feel depressed and disillusioned. So that can happen when you're focusing your energy in a path that's not supported by your soul. So you get this burst of energy to do something, but it may not even be something that's actually fulfilling or meaningful on a deeper level to you. And so at a certain point, that burst of energy dissipates because your soul is not supporting it. Your soul would actually desire for you to be focused in a different direction or different path. And until you align with that more meaningful, more purposeful path, you're going to continually be swinging back and forth. Your energy burst will drive you forward, and then it'll collapse because there's really nothing to sustain it. No deeper purpose there. You would want to find some environment or cultural context that supports you spiritually in becoming and expressing your deepest desires or what's really meaningful for you. And if you're able to do that, you'll often find that you come back more into balance, you're not going to have these extreme swings anymore. Your energy will be more steady and sustained because you're focusing it on what your actual purpose in your life, the one you've chosen, actually is. So that's something to consider if you're looking for a long-term resolution of bipolar disorder. You can certainly do things biochemically, such as cutting out processed foods, making sure your body is adequately nourished with minerals, vitamins, with a balance of amino acids, so the chemical elements being in balance. But you could do things to work on balancing your chemical elements, but then energetically and spiritually, if things are way out of balance, that will start to have a ripple effect again back into the physical. It'll push your chemistry back out of balance, and even doing some of the natural medicine biochemical therapies might no longer work to suppress your symptoms. So you want to consider all these different levels to ensure a long-lasting, sustained recovery from bipolar disorder, and this goes for other mental illness diagnoses also. You want to address all these different levels so that you have a more complete, more long-lasting recovery. So I would encourage you to learn about the 5 levels of healing, the work of Dr. Dietrich Klinkhardt. He has a document, a graph in a sense, an illustration of that model. So that is a good reference to use when you're looking for therapies, for ways to support your healing. For those that are looking for additional support, for more guidance with holistic health and spiritual growth, I invite you to visit my website. That's phinsights.com, phinsights.com. For now, I'd like to wish everyone a wonderful day. Namaste.